Hi, my name is Sandra, and I'm here to explain what you will experience when you come to Memorial Hospital Pembroke. We want to make sure you have all the information you need to feel comfortable and to prepare for your procedure. First of all, if you develop any symptoms of cold, flu, infection, or have any change in your condition on or before the date of your procedure, you need to call your physician or surgeon. This won't happen to most people, but it is very important that you call if it does happen to you. Now I'll explain what happens before your procedure. The first thing that will happen is a pre-admission phone call. Before your procedure date, a pre-admitting nurse will call you. During this call, the nurse will ask you questions about your medical history and the medications you are currently taking. The nurse will also give you instructions about what you will need to do to prepare for your surgery. The pre-admitting nurse will ask you for the names and dosages of all medications you are taking, including vitamins, herbals, and over-the-counter medications. Please bring a list of these medications with you on the day of your procedure. If you are having a CT or ultrasound-guided biopsy and your scans weren't done at a Memorial Healthcare System facility, you need to bring these images or scans to the Radiology Registration Department at least 24 hours before your procedure. Stop taking aspirin or any blood-thinning medication 5 to 7 days before your surgery unless your doctor or the pre-admitting nurse tells you to continue. Beginning the night before your procedure, it is very important that you follow these instructions. First, don't eat or drink anything after midnight the night before your procedure. Your stomach must be empty for the procedure. When we say nothing, that means nothing. No gum, breath mints, candy, or cough drops. You can brush your teeth, but don't swallow any water. Do not smoke, drink alcohol, or chew tobacco at least 12 hours before your surgery is scheduled. If you are on insulin, do not take it unless instructed to do so by your surgeon, physician, or pre-admitting nurse. Now that we've talked about what you shouldn't put in your body, we'll talk about how to prepare your skin for surgery. You need to remove all jewelry, including body piercings, the night before your surgery. Bathe or shower the evening before or the day of your procedure. Do not apply any powder, cologne, perfume, or makeup. Don't use deodorant if your procedure involves the arms, shoulder, or neck. Remove nail polish. Finally, wear comfortable, loose-fitting clothes. Now we'll talk about what needs to happen on the day of your procedure. If you take any heart medication or blood pressure medication, please take it as prescribed with a sip of water on the morning of your procedure. If you use inhalers or a CPAP, please bring them with you the day of your procedure. You may be asked to remove dentures, partials, and eyeglasses. Please do not wear contact lenses. Now let's talk about what to bring with you. We'll give you a hospital gown and robe, but you should bring a robe and toiletries if you are being admitted. Children having surgery can bring a security item such as a favorite toy or blanket. You will need to bring cash or a credit card if you will be required to pay a deductible or any other charges. You will also need to bring identification and your insurance card. Now that you know what you need to bring, it is important that you know what not to bring. Don't bring any jewelry with you. Leave it at home. Also, don't bring any other valuables with you. We're almost done here. We're down to the final details. It is important that you fill any prescriptions your doctor may have given you during your office visit. Often you will need to start pain medication once you arrive home to ensure your comfort and ability to rest. Please arrive at your scheduled arrival time. You will learn the time during your pre-admission phone call. Finally, if your procedure requires anesthesia, taken either by mouth or intravenously, an adult driver will need to take you home after your procedure, so make arrangements for one to be at Memorial Hospital Pembroke that day.